Hello, it's Doctor of Mind. The term dose is used differently by different disciplines, I've noticed. For example, a psychiatrist might use the word dose to describe the strength of the medication. For example, 10 milligram dose fluoxetine, 20 milligram dose of olanzapine, 100 milligram dose of thioridazine. This refers to the strength of the pill, and as a physician, when writing a prescription, the first line in Latin is the name of the medicine, strength, and what form it is. For example, fluoxetine 10 milligram capsule. The dose refers to the 10 milligrams. That's how a physician or doctor might view the word dose. It's a noun. Now I notice substance abuse counselors apparently have converted the art of prescribing into this one verb, dose. Did you dose the patient? Did you guess dose? We're gonna dose him at this. I dosed a patient. It's not a verb. This is kind of disrespectful to the physician in the sense that you can't reduce an art of prescribing to a task like you dose, dispense a certain amount out of a dropper. It's not really a verb. If you look up the word dose, and I believe it's more used as a noun. So it's very kind of not good clinical practice to just reduce the actual assessment, diagnosis, treatment to a simple verb, dose the client. Oh. So it's very interesting being in both arenas because many psychiatrists are anti-substance abuse. Oh, maybe if you don't do meth, you wouldn't be depressed. Or maybe if you stop drinking, you won't be anxious. That's very narrow-minded. But I've also noticed the same kind of cultural issue from the substance abuse people onto the psychiatrist. What do you mean? There's no pill for voices. There's no simple pill to be happy. Whereas psychiatrists, if you look at the PET scan of depression after treatment, you see the changes. You might say there is medication for depression. Or take a look at the D4 blockade of clozapine in the mesolimbic lobe, causing where the auditory hallucinations arise and are blocked with antipsychotic stellar medication like clozapine. So there is a pill for voices, there is a pill for depression. For anxiety, maybe you got a point, but I love trying to study both angles, and I'm an actual clinician that's dabbling in both fields, and it's just very interesting. Of course, the government has them both under the same umbrella, right? Substance abuse and mental health system. That's a subdivision of the Department of Health and Human Services. So they're actually, mental health and substance abuse is under the same umbrella. Absolutely fascinating. This is Friday evening with Dr. Mind. My evening, I don't have a weekend. You know what I'm doing this weekend? I'm on duty